insurance, in spite of what the insurance companies tell you, again, I don't question the sincerity and the genuineness of those of you that, number one, don't like me, or number two, don't agree with me on this, and number three, don't like President Obama for whatever reason you don't like him. That's all fine. What I do, I'm not pointing fingers at anybody in Blue Ash or Lebanon or Indian Hill or Wyoming or Harrison. I'm not pointing fingers at anybody about what got you here and what your views are. I'm simply pointing out that the insurance industry, when a guy's making $24 million a year, he's just one of those guys. Perhaps you think he should make $30 million a year, but if a guy that's making $24 million a year, if it's human nature, he probably wants to hold on to it. So a lot of this information, in spite of the fact that they're telling you this, there is a prohibition on this bill. No illegal aliens get anything out of this bill, period. That's in the bill. If you read it, you see that. So that's number one. Number two, I don't, Mr. Weber. Mr. Weber obviously talked about competition among the 1,300 insurance companies, and I know, again, there's a lot of difference of view in this room, but I would trust Medicare more than I would 1,300 insurance companies. I knew there was a disagreement on that, but I trust, I've never heard Medicare denying care because of pre-existing conditions.
Yeah!
I've never heard Medicare deny care because of parole. I've never heard Medicare deny care because they're going to discriminate. So, focus on the
My name is Peggy Schluter. And
Schluter?
I'm sorry, my handwriting wasn't great. It's Schluter.
Schluter, I'm sorry, I apologize.
And I do live in Cincinnati and have for 30 years, but I was born in Lorraine, where the senator is. The previous questioner asked my question, but I have another one real quick. This government-run healthcare experiment has been happening in Massachusetts. And to a total disaster to the state of Massachusetts. There's rationing of care, people can't get into their doctors. It's just a nightmare for them. And we do not want that on a national level. So I'm assuming you're going to vote for this bill by all your comments. How is the government option going to be different from the state of Massachusetts government run?
Thank you for the thoughtful question, Ms. Schluter. I appreciate that. We looked at the Massachusetts plan. The Massachusetts plan is still only a couple years old, so it's got problems, of course, as everything does. But we looked at it and we learned from it. One of the wonderful things about the United States is, we have 50 states. Each of the states does things differently. Thomas Jefferson said the states were the laboratories of democracy. So we look, what does Wyoming do well? What does Ohio do well? What does Indiana do well? What did Michigan goof up? What did Massachusetts goof up? So we've learned, I think, from Massachusetts. We're doing some of the things we think work, like guaranteed issue. We're doing, everybody gets coverage, but Massachusetts didn't do anything that looks at all like our public option. Well, the doctors, I know there are problems, and I'm not saying there aren't problems in Massachusetts. We want to learn for it. Yeah, I would vote for the bill the way we voted out of the Health Committee. I want to see this bill continue to improve. I'm not done. I talked about some of the suggestions that conservatives have had here that don't much agree with the bill. I've listened to, and I think we can learn from that. But I think this bill takes some of the good things from other places and rejects some of the bad things, and we'll keep trying to improve it. But your critique of Massachusetts is not totally without merit.
77%.
She said the polls say.
That's the second question.
I appreciate getting the follow-up. I need to get
public
to
plan.
She says the polls say Americans don't like this bill. Most of the polls have shown
I love it.
this bill overall. Especially for the
We love it.
My name is Nick Hazel. I'm a retired pharmacist and a volunteer at a charity pharmacy in the West End. I came about to volunteer because of the need. And with these pharmacies give people medicine, and I wish that I could work myself out of a job as I did in the Peace Corps in Afghanistan, but they're now in Dayton, Columbus, Zanesville, they're all starting out. So this is not the country that I grew up in. This is not health care. My wife was in a hospital. I'm speaking again from personal experience. She had tests, she had tachycardia. The bill was $14,000 without surgery, one night in the hospital. This is not the America that I grew up in. And I also like to say that the word healthcare is a misnomer. We don't have a healthcare system.
Sick care.
We have a health market system. Where profit is more important than the patient.
Yeah. Well said.
Mr. Hazel, first of all, thank you for your care. Thank you for Mr. Hazel. Thank you for what you do for low-income people and all kinds of people that can't afford the prescriptions. I think this diagnosis through healthcare system is pretty darn good. Okay, your question, and then I'm going to take one from this side. Can you choose who you got? Okay, choose who you're going to do it. Okay, you're going to do it.